Hi, Emily. Welcome back to counseling.
Hi, thank you.
How have you been since our last session?
Not too good. I still haven't gotten my job back yet.
I see. Have you been making any efforts to get it back?
I have. I'm trying not to drink every day, but sometimes it's hard, so it's a battle that I'm working on.
I know it must be hard to change the way you've been living your life recently.
Yeah, it's hard. It's a hard road for me.
Do you think that maybe working a little bit harder will get you to where you want to be? If this is, like you said in your last session, something that's really important to you, do you think maybe it might be worth it?
It will be worth it, but I think it's easier to say that it will be worth it than actually doing it on a daily basis.
Yeah. Okay. So first off, I would like to talk to you about the approach I want to take with you. It's called cognitive behavioral therapy. Have you heard about it?
No.
No? Okay. Basically, in this approach, it's going to be a collaborative alliance between me and you, and you're going to have to be an active participant in therapy. So basically, you have to make some efforts. Is that okay?
Sure, yeah.
Okay. Basically, with this approach, the view is that psychological problems are stemmed from a faulty cognition. So basically, in your case, your problems with drinking and your fears with men and your problems with relationships are all coming from the way you're thinking about this trauma that you can't get over. Does that make sense?
Yeah.
Yeah.
Makes sense.
Okay, so I think it'll be really helpful if we use this approach to get you to fulfill all your goals.
You're the doctor, okay.
Okay. So our main goal here is to have symptom relief. So obviously we want to get you to stop drinking, and we want to get you sleeping better. We want to get your job back.
I want to stop drinking. It's something that I battle every day. I would love to be able to sleep all night for 8 hours in a row. I would love that.
Of course. So what we need to do is modify your dysfunctional thinking that you're experiencing right now so we can get your behavior on track with where you want to be in your life.
Okay.
Okay. So a couple techniques we can use. First of all, we can do cognitive restructuring. Have you heard of that?
No.
Okay. Well, basically, we're going to monitor your self-talk in this. So throughout the day when you're thinking, oh, I can't handle this, I'm never going to be able to deal with this, all those types of negative thoughts that just automatically come in your head, we're going to stop those. And you're going to push them out, and you're going to try to reframe them in a way that's positive. So no, yes, I can get through this. I've gone through this before, and I'm going to be able to move on. Does that make sense?
It makes sense. I'm just hoping I'll be able to do it when those thoughts come to me. I'm hoping I'll be able to get over the negative thoughts and only think positively.
Well, it's definitely going to be hard, but it's something we're going to work on. So we're also going to have you do homework. So a part of cognitive restructuring exercise would be throughout the day to write down every time you have a negative thought. And then you're going
Like a journal?
Kind of, yeah. So you'll write down that thought, and then you'll write down why you think you're having this thought, and then you're going to try to reframe it. So you can try to think of it as a positive way. It'll kind of help you see that not all your negative thoughts really need to be there. You can make them positive.
Oh, okay.
And this should help you see that your negative thoughts aren't really necessary all the time, and this should help you with your behavior. You should be able to stop drinking less, hopefully.
Has there been a success rate with this in the past?
Yes. There have been studies that show this is effective in clients, especially with PTSD.
Well, that sounds encouraging.
Yes, it does. Also, I would like to try exposure therapy. Have you heard of that?
No.
Basically, we will have you exposed to a stimuli that you are afraid of, so men. So we'll put you in a situation where you're around men, and we'll basically show you that you can handle it. And eventually, you'll feel more and more comfortable being around men.
Okay.
And that was something we talked about in your last session that you would like to be able to do. Seeing as you would like to have a relationship, you'd like to be able to be around men without feeling uncomfortable.
Definitely.
Okay, so that's something we can work on in the future. So also I want to say that with this approach, the focus is going to be on the present. So we're not going to be so much as talking about the trauma of your childhood and all those problems. We're going to mainly focus on the presenting problems of the drinking, the friendships, the relationships, and getting your job back. So
I would like to get my job back. Yeah.
Yes, that's the main one of the main treatment goals.
And a lot of bills to pay.
Of course, it must be really hard
It's
not
very
having
hard.
a job.
Yeah. A lot of bills I haven't been able to pay.
So it's very important to get this job back. Plus,
Right.
you said you enjoyed it.
I do.
So that might be a good thing to have in your life again. So let's get back to where we started with your story last time. Is there anything else you want to talk about?
I would just like to see progress being made. I'm just so frustrated. I feel like I'm always in the same spot. I feel like I really haven't made that much improvement as of yet, and I really would like to see that happen in my life. I'm frustrated with myself.
I can understand that completely. I think that through exposure therapy, the cognitive restructuring, and the homework that will help you further progress outside of therapy, you'll be able to see more progress in those areas.
I would like to see that happen.
I would like to see that for you too. So where do you think we need to work with your job? Besides the drinking, what else can we do?
I think if I start to try to reshape the way that I think and keep things more on a positive level, it probably will help me view things better and potentially help with me not drinking on a daily basis. I think thinking positive is going to be key for me. Just a hard thing to do, given everything I've been through.
I agree. It's definitely going to be hard, but like you said, you think it will be worth it when you have the job, and it'll take some stress off your back when you can
pay my bills.
Pay your bills, right? Exactly. So maybe we can get you to fix your relationship with your mom. Maybe she could be a good support system for this.
Yeah, I agree.
Yeah. We can maybe help you because Violet says your mom suffered from substance abuse, so maybe you guys can go through this together. She can help you, give you some tips, and be a good support system.
I agree.
Okay, so we definitely need to work on the relationship with your mother then, so she can definitely help you with this. Because she can probably help you get your job back too, because you can stop drinking. You can definitely get your job back, because that was the condition when you were fired, wasn't it?
One of them, they said, is that attitude too. So.
Well, then I think the cognitive restructuring will definitely help with that. If you have better all.
I said I was very abrupt sometimes.
The best. Well, perhaps if we can alter your way of thinking and become a more patient teenage-art elementary school
That's
teacher.
what I want. That's what I want overall.
That's what you want. I can imagine working with children must be very difficult. You need to have a lot of patience.
And sometimes I didn't have patience.
You need to be warm, friendly. You don't want to scare the children.
Right.
Right, yeah. Maybe your boss and coworkers will be more welcoming, have you back.
That would be great.
Yeah, they see that you're changed. So it sounds like you have a lot to work on right now.
Oh, I do. So, that's for sure.
Okay. Do you have any other thoughts of how we could maybe get you to stop drinking? I think that's the main issue here right now.
Personally, myself, I don't. I would like to try the approach that you keep saying and see that if it does work. And you said that there was a success rate in the past. I'm hoping that it works for me.
I have a positive outlook on this. I think it'll be really helpful for your case.
That's what I want.
Yeah. So, is there anything else that you would like to address today?
I just really want to try to get my life back on track. I want to, you know, feel that I'd be happy, have a paycheck, have a job I like.
It must be really stressful.
It's very stressful, and the stress makes me want to drink even more. So I feel like it's a big fat circle.
Yeah, it's a vicious cycle.
Mm.
Well, we need to break that cycle, and we need to get you back to where you want to be.
Well, thank you for your help. I appreciate it. I'm hoping going forward that this does work.
That's what I'm here for.
Mm.
So I would like to make an agreement with you before you leave today that for the next 6 days for our next visit, that you will, starting from when you wake up to when you go to bed, you'll record your negative thoughts when they happen.
Mhm.
And I would like for you to try to stop them, because most of them can be avoided and they can help change the way you think throughout the day. So write those down. Write down what you think is underlying all those, that keeps recurring. And then I would like for you to try to reframe those in a positive way.
Sure.
Okay, do you think you can do
I
that?
can do that, yeah.
I think that by doing this, you'll be able to make a lot of progress outside of therapy.
I hope, right?
Yeah, since we haven't progressed much so far, I think this will be a good step in that direction.
Okay.
And then next time, we can work more on the restructuring in therapy, and then we can talk about doing some exposure therapy.
Okay, that sounds good.
And then I would also maybe like for you to try to work on that relationship with your mom.
Mm-hmm. I agree.
Yeah, because I think that'll definitely benefit you in multiple ways. Not only will it help with the support, she can help you with your drinking, but like you said in your first session, you wanted to kind of mend that relationship.
Right, I think it's going to only help me.
Yeah, I think that definitely can only help.
I don't mean to cut this session short, but I also have an AA meeting that I'm trying to get to too.
Hey, that's awesome. I think that'll also be something that can definitely help you. I think that's wonderful.
Yeah, there's a lot of good people that are there, so I'm hoping.
I think that's been really hard to make that step
Mm.
after all these years. I think that's awesome that you did that.
Thank you.
You're welcome.
It's a step in the right direction, I see it as. So.
Absolutely. I hope that you'll continue with that, and I will continue to help you.
Thank you. I need it. I need all the help I can get at this point.
Now you have more support with your, what do they call it, a buddy?
Yeah, I have a sponsor.
A sponsor, yes. I feel like that will definitely get you to where you want to be.
Especially when I call her like 2 in the morning, she's so helpful. So.
And right now you don't have any other support. You said you didn't have a relationship, family, friends.
No.
But this is definitely a good move.
Mm-hmm. Yeah, it is. So I'm thankful for that.
Definitely. Well, I hope you keep up with that and work on the homework and continue being an active participant in this therapeutic setting. Well, thank you. I'll see you next week.
Thank you very much for the help. I appreciate it.
You're welcome.
Take care.